So we have some new data about the PD-1 inhibitors at ASCO, but just to make sure that we're all talking about the same thing, we're talking about squamous head and neck cancer in patients who cannot be cured anymore. So we're talking about cancer that's either locally recurred in the head and neck and there are no more surgery or radiation options, or that has spread outside of the head and neck. And in particular, we saw a lot of data this year at ASCO in second-line therapy. So meaning that somebody who is not curable with head and neck cancer, being treated with the goals of extending duration of life, being treated with the goal of preserving quality of life, who've received prior treatment and now need a different therapy because it's not working anymore. I'll start off by briefly describing the results of the Checkmate 141 study. So the standard chemotherapy used for the second treatment, there are a variety of drugs. I think it might be fair to say there's controversy over what's best and no proof. But some of the commonly using drugs are methotrexate, cetuximab, or docetaxel. And so this was a very practically designed study. It randomized people in the second line of treatment to one of these agents, dealer's choice, whatever was thought best, or to the experimental agent, which was nivolumab, one of these PD-1 inhibitors. And the theme here was the nivolumab worked better. Survival was better. It was 5.1 months with the standard chemotherapy, up to 7.5 months survival with the immune drug. And that didn't come at a toxicity cost. In contrast to when we improved survival with historic regimens, toxicity was much, much better for the new drug. And there was a greater portion of patients at what doctors call the tail of the curve. And the tail of the curve in plainer English is what patients always come in, I think, asking us for, which is a chance, some opportunity to be counting survival in years instead of in months. Durable control, which sometimes happens here. Gentlemen, anything you wanted to add or comment on with the Checkmate data?
Yeah, one of the things that I thought was very interesting was it did randomize to 3 options. It was docetaxel, cetuximab, or methotrexate. The response rate to methotrexate is really, really low. It's about 5%, so much so that I don't think there are many practitioners in the United States who are using it in this space. And so if you look at the data, over 40% of the patients on Checkmate 141 who were randomized to routine chemotherapy received methotrexate. So calling it randomized to routine chemotherapy is a little bit confusing given that it's not terribly routine.